Okay, all right. I'm a sentient talking eggplant that can't believe they are still doing this in 2021, but here we are uh, with Danielle Smith, February 22nd, 2021, on the Ryan Jespersen show. Let's see what she has to, she's got more information about COVID. Let's hear it.
On a mainstream media platform. But doctors who are testing out therapeutics and having good success of it, just because Dr. Fauci hasn't put the rubber stamp on it, doesn't mean that they should be deplatformed. And so in the intervening period, I actually just saw another article today. There's a doctor, Dr. Zielinski in New York. He's a Jewish doctor serving the Jewish community. He just gave his most recent results because he's had 3,000 COVID patients. 1,000 of them were high risk. And so he put them on a combination of hydroxychloroquine, zinc, and azithromycin. And only 15 ended up in hospital and only 3 of them died. And so that's worthy of us in the media saying what's going on there. I think.
So here we are. There's a doctor called Dr. Zielinski in New York, right? So let's look at what she's saying, right? There's a doctor, Dr. Zielinski in New York. He's a Jewish doctor serving the Jewish community, and he just gave his most recent results. He's had 3,000 COVID patients, 1,000 of them were high risk, and he put them on a combination of hydroxychloroquine, zinc, and azithromycin, and only 15 ended up in hospital. Only 3 of them had died. So I think that's worthy of us in the media saying what's going on there. Right, so I don't know who this Dr. Zielinski was, and I didn't know what this 3,000 COVID patients are, right? So I Googled it, and I don't think Google's a tool that Danielle Smith knows how to use, but here we are. I looked at, I found this link for Vladimir Zelenko, right? Is the nearest name I could find to this, and then I looked on Twitter for 3,000 and in New York and doctor, and then I got hits from February 5th, and then I dug down deeper, and then I found that okay, Zelenko, 3,000 people back in December. I've got hits for this, and then back in December, 3 deaths out of 3,000 Zelenko. So he's the only Jewish doctor in New York that has these numbers. So I think she means Zelenko and not Zielinski. But let's get into that, right? So I keep on searching for this video. So this is the most recent results. It's February. People in December are saying what Daniel's saying in February, which is kind of different, kind of weird. But let's continue with that. And then here's this doctor Zelenko that Daniel's ultimately talking about.
State. And my data showed an 84% reduction in hospitalization and death in the high-risk population. Let me rephrase it. At that time, we had a cohort of 3,000 patients with COVID. I risk stratified and treated medically only 1,000 of them. At a 7.5% death rate, you would statistically predict 75 dead people. I had 3 dead people. So that was you know what that implies? That means end of pandemic. That's what it means. And I came across terrible opposition. I got defamed in the media, slandered. I lost my position where I was working because of the political pressures.
Yeah. So this has to be the guy, right, that she's talking about. So there's nothing she quoted in the show as a source, but this must be the guy. And this video is from January, right? So about 30 days ago. But he's actually talking about stuff that happened earlier in the year, right? So the timeline is April, right? He publishes a bunch of baloney and says that he's doing an FDA approved trial. And then this other right-wing nut job, Jerome Corsi, forwarded an email from him to Aaron Zielinski, which is a completely different person and used to be on the part of the Mueller probe. And then he investigates Zelenko's claims. And then Zelenko, because of the fallout from this, has to quit in May 2020 And then he blames everyone else in his Jewish community for the COVID deaths. And you could read this article here if you don't believe me. And then this is how Danielle Smith has interpreted events, right? So he says she thinks that Zelenko and Zielinski are the same person. She's mixed up the names here completely. And she's saying that Zelenko just gave his most recent results about 300,000 patients, when he himself is talking in January about some stuff where he basically was out of practice in May due to political pressure, right? So what new information is he releasing in February? Well, there's people on the internet talking about it in December, right? So I don't know how Danielle got this memo, but she's 2 months behind other crazy people on the internet, and she's 6-8 months behind the Dr. Zelenko himself, right? Yeah, and apparently he was at the DC riots and all that, according to Wikipedia. But let's just continue on this. So she's just plugging hydroxychloroquine. Still, it's just ridiculous. And then she has something to say about epidemiology, right? So let's get into that.
Percent of fire code regulation. They have streaming capabilities. That's how I'm able to pull their sermon to show our viewers. They've figured it out. And to me, it's more a matter of principle. It's a matter of defiance. And to me, it slaps every other Canadian in the face.
I guess because I've looked at other jurisdictions where they haven't come through with quite as many extreme restrictions, I guess I differ with you in looking at how the lockdowns work or don't work. I mean, I look at places like Florida, South Dakota, Sweden. They've got the same trend on the course that this virus goes. So that says to me that the virus will do what the virus will do. There seems to be, again, going back to how illiterate we are on medical issues, and if you talk to epidemiologists, they'll tell you a couple things. They'll tell you that viruses do this. They have a cycle where they rise and then they fall off. You get the impression, listening to politicians, that you're going to have exponential growth forever and ever and ever until everybody's infected, and it's going to result in massive death. That's just not how viruses work in the real world. So we've gone through, and if you look at our own stats in Alberta, we peaked December 4th. Now, there were some small restrictions that came through before that, but the major lockdown didn't happen until December 13th. And we know that there's sort of a 2-week delay. So the virus had already peaked prior to the restrictions coming in. They may have helped, sure, I'll take that. But we were already seeing that because we're in respiratory virus season, it has a trend. It peaks in December, January, and falls off by February. So I would say that the government should have matched their restriction policy with that. And so that's the real problem they have, is that they're slow in easing the restrictions. You've got people, and I think I've seen some of.
So this is just completely nonsense. Nobody else is saying that, and she has no sources of this conclusions, or she's forming causal relationships on her own with no data or statistical analysis to back her up. This is just complete nonsense, and it just is based on nothing. And then she, for the record, this is what she has to say when, Bill Gates chimes in about vaccines, right? Bill Gates, has a Bill Gates Foundation. I don't know how many billions he's committed to public health research. And this is how Danielle speaks when, Bill Gates shares his opinion on COVID and vaccines.
Now, I'm not quite sure.
This is, by the way, shared in August of last year.
Now, I'm not quite sure why Bill Gates has emerged as the preeminent voice on medical vaccines, when I guess it's because he's an expert in computer viruses, although there isn't an immune system on computers. So I think computer viruses spread differently than viruses in the human population. That's just sort of my uneducated observation. But apparently he has become the world expert on vaccinations. So
this is like complete projection, right? Because it's like the Dunning-Kruger effect in action, right? The amount of stupidity, like who appointed Danielle Smith as the resident expert for coronavirus in Alberta? It just is completely ridiculous that this person is in media in Alberta. and it shows how Alberta's just done horribly compared to the rest of Canada. And here's some of the just in some of the many stupid sins of hydroxychloroquine. Danielle Smith. Danielle Smith is the only person left in 2021 still pushing hydroxychloroquine, right? This debate was over once her daddy Trump didn't take hydroxychloroquine for his own infection, right? So this is a done debate, right? I mean, he took it prophylactically. He got it, still got it. And then as a treatment protocol, he didn't take it again. So done deal. I mean, if you're not going to give it to Donald Trump, who are you going to give it to? People in, Wetaskiwin, are you just going to be, buying up the hydroxychloroquine from the states in the United States trying to give it away right now? Just completely stupid. Now, and then Danielle Smith, she thinks she's a statistician and epidemiologist because she has a column in the Calgary Herald every week where she sounds off about, COVID and renewable energy and everything in between because, she has a BA in English. This is just complete nonsense. And then she, as she did in the video, she's saying other people are illiterate on medical issues. And then this is the many things, there's many layers into this, but she also makes dumb and contradictory statements, and she doesn't realize her own treatment protocols are in conflict. If she read Paul Merrick's ivermectin study, she'd realize that he doesn't recommend hydroxychloroquine, right? The only people that are doing this cafeteria selection of treatment protocols are straight up crazy people like Dr. Zielinski, right? He's the only guy out there that she could have found that would even consider mixing ivermectin with hydroxychloroquine, right? So she doesn't even follow up with her own research, her own cited research, and pick a lane, right? Treatment protocols aren't just the kitchen sink. That is not a medical model, as far as I can tell. And I'm not a doctor. I'll be the first to say that, but I know how to use Google and read a fucking paper. Like, this is the most ridiculous thing. And she's just a lazy person. And then she makes really pathetic errors like Zielinski and Zelenko. And then she pronounced Fauci for many episodes on her show this year or last year as Fauci. And she assumed that Beta Stadler, which is a Swiss doctor or epidemiologist, who early on he had his translated media article from German, and she said, "Oh, I wish I could interview him, but he's German." But he does English interviews on YouTube. It took me 2 seconds to find an English interview of the primary source, and she didn't bother to follow up. But it's her own crazy primary source. And then, and the cherry on top is she reads conspiracy theory websites like Swiss Policy Research and Zero Hedge on air, like full pages of this nonsense, right? So, this interview between Ryan and Danielle, I mean, it just goes to the entitlement of radio people, right? They think they can they're radio people. It's their freedom to have an opinion, so they get to have an opinion on, coronavirus in the middle of a pandemic, and they don't need to check their facts, even though the facts are staring them in the face, because anyone that can use an iPhone correctly can see that what Danielle's saying is complete nonsense, right? So this is just completely unacceptable. If you want an opinion, have an opinion about baseball. Be a sportscaster. This is just completely stupid. People COVID is straight up science, and if you don't have your sources in order, then you can shut the fuck up. All right, I'm done.